So I'm going to ask Howard Rosen, who's CEO and president of LifeWIRE, and should I say a movie star, a rock star in the mobile technology world. Basically, he's a leader for sure in mobile health and has been named as one of the top 30 mHealth innovators of 2011 by the mHealth Alliance, which incidentally is hosted by the United Nations Foundation and I believe the Rockefeller Foundation. Howard has just been named 2013 Computer World Laureate, which is a humanitarian award for the use of technology for the benefit of society. He has written policy for this sector on behalf of the province of Ontario. He is an industry reviewer for the US Department of Health and Human Services. He's addressed the US Congress on the subject, and he's a member of the Working Task Force for HIMSS, as well as one of their conference speakers. He developed the LifeWIRE platform in 2005 and has been refining it in the years since. Sulch, is that the right pronunciation? MBA with over 2 decades of experience in media and entertainment. It's really interesting. And he brings a unique perspective to this approach in the issue of treatment adherence and patient engagement.
Thank you, Vince, for the introduction. Thank you, everyone, for coming today. As Vince alluded to, as most of you here, my background in health is like yours. I spent 25 years producing film and television before getting in healthcare. What that has brought with me is sort of my perspective on everything that we're doing, and part we're going to talk about now, is the perspective on patient engagement. And that's what it came to all this, was really on the engagement side. Sure, you've got the innovation, you've got technology, and that's part of what we've developed. But first and foremost, it's all about engagement, is what we're trying to do. And our success really is to make the technology invisible to the patient and the providers throughout the entire ecosystem. In putting this all together, we want to look at, okay, what do patients use? How are they accessing it? And I come from, I'm not going to tell the patients what they need to do. We're looking at what are they telling us they want to use. And overwhelmingly, what we're finding is the use of text messaging. Overwhelmingly, 99.999% of people in our system are going to use text messaging from the patient side. And if you look at the statistics, in 2011, there were approximately 2.2 trillion text messages sent in the US, which comes down to about 2.5 billion messages a day. So the horses have left the barn in terms of, is text messaging going to be a means of modality for healthcare? It is, because everybody's using it already. So instead of trying to find ways of fighting it or trying to put it into a box, we want to take the other approach and let's find ways of using it for the benefit of patients and for the benefits of the providers. So again, as we sort of talk from this particular slide, and as Amos had said, the key thing to that is not just sending a message. What you really want to do is drill down so it actually has relevance to the patients. What's the best way of getting engagement is actually giving information that's valuable to them. And so we're looking at, you're personalizing this information. It was interesting, it gave a speech a couple months ago, and on the plane, it was in the Smithsonian, talking about someone who came out with a US dictionary of idioms and how different parts of the country use the words differently. And if you use the words incorrectly, you actually get a real pushback. And so now it's tied into part of what we're doing, is having the ability to take messages and take the discussion to the level where you're actually talking to somebody in a manner they want to hear about. You can use slang in any language, whatever the case may be. Because unless you do so, you're going to get pushback from them. Like I remember early on when we were doing some pieces, we got a comment from somebody in California, who's in Southern California, said, this sounds like somebody in a suit in New York City wrote this. And that was the reason why they didn't use it. And it's amazing how people feel about that in terms of the interaction. They feel very personal. If they're getting a message from somebody, and however it comes in an email, it has to have relevance to them. And so everything we're trying to do, and we're working with the patients, is to be able to get messages that tie to them. Again, text messaging, there's, at this level, there's 6.3 billion cell phones in the world. All of them are immediately activated by text messaging. And there are over 17,000 healthcare apps. There are approximately, I think, 72 different operating systems and mobile providers around the world. And so in working this through, and if you want to have an app, that's fine, but you got to have an app that works for all these various pieces. Again, in terms of the provider side, when we're talking with them, they're saying they want instantaneous. They want something that's just going to work right away. They don't have to go to their clients or their patients and say, okay, you've got to do this, and here's a 16-step process you have to go through, and upload, download, go to call centers, deal with the case may be. They want instantaneous. And so what we keep on looking to do is finding ways of getting more direct and simplifying the process as much as possible for the patients and the providers. And as I said, obviously we'll deal with mobile and engaging, because, as I said, it all comes down to that engagement level. Unless you get them involved in that process, you're not going to get them to improve their conditions. Part of that is not just, it's fine to just send a message back and forth with the patient. It's interesting data and everything else. But if you really want to work with them, you got to involve their larger ecosystem, again, as Emma suggested, and as Patrick is suggesting as well. And so it's finding ways of not just having the interaction with the patient, but also having an outreach from the patient at times that are relevant to them. Just as an example, we do a lot of work with wounded warriors. And we send messages back and forth with post-traumatic stress disorder, high-risk suicide, and other areas. And we're sending messages, and we send motivation messages that are tuned to their needs. And we got good responses, and it was working fine. Everyone was just very happy. But the clinicians were saying, that's good, but we're trying to get a better sense, and we're still trying to find what's that magic sauce, how we can get that push further to get them even more involved and more active in their own care. And in talking to, and we had built into our system, we're able to sort of have third-party notification. So depending on the response, it sends additional responses out to the case manager wherever they happen to be. But we're sitting down with focus groups, and the key thing, and this is a key thing that we do with these things, is we focus group every new patient group we bring on focus group with peers. So the messaging, the approach, the context of everything are very tied to their peer side, which does two things. One is it allows us to drill more quickly to that content side with the clinicians. And secondly, the group who are receiving the messages all know that this was help created by their peer. So it goes back to, it's not a bunch of suits in New York or Washington or wherever who created these things. This is actually done by their peers, so it's more relevant to them immediately. But one comment we received from one of the wounded warriors was early on saying, man, it's great that the case manager knows, but wish my buddy could know when I'm feeling badly. And we went, can you do that? And we went, there's no reason why not. And we've built out that whole social media peer side. Again, all permission-based are satisfying, all HIPAA, you name it, it's satisfying it. But we built out that whole social side to it. The technology aside, where we found that as a driver is, it's almost like they said it created a comfort to know that they had more just than the case manager. They actually had a peer, a connected group that was important to them, also knowing how they're feeling when they're feeling lousy. In terms of wounded warriors, and it was fascinating, we actually talked to the guys we work with at the VA I was trying to understand it as well, like why is this so powerful? And I think it was touched on where in terms of the wounded warriors, they're a unit when they're trained. They're wounded when they're theater of war. They're a unit when they're going to theater of war, and as soon as they come back to the mainland, they're broken up. But their mindset is they're a unit, and the unit is something missing. So the fact of knowing that when they get a message and they respond a certain way, it actually connects to their larger group, provided a great amount of comfort and engagement and involvement with them, that they know that their buds may connect with them when they're feeling lousy. And that peer and that whole ecosystem connectivity is a huge driver to it. So in putting all these things together as we work with our various clients, and as we're working with providers, it's to work on that whole ecosystem. So providing that supports, providing that comfort, providing the content side that is relevant and continue to be relevant for their needs. Because this is the connectivity we're doing with people is not just short-term, it's on an ongoing basis. We could talk later in terms of results and everything else, but I could tell you, but the value proposition is very high. The more you're able to drill down the content and the simplicity of that, of the relevance to the individuals. And so as we're building all these technologies, which are wonderful, it's important to make sure that the context is there and the content is drilled for that patient's particular needs.